think we are live here. We are live at lunch. Welcome to everyone who is coming into the room. We are going to be talking with a very special guest today, so I hope that you'll join us. I am very pleased to introduce today's live at lunch special guest. I am joined by Rose Horton, who is a maternal and child health professional and who has sparked a whole entire movement with her passion for serving women and children. And she's going to be talking to us today a little bit about her career path and also about her newest venture, Antonia and Grace, which is a concierge birth service. Keep watching to learn more. And I'm going to let Rose tell us a little bit about who she is and how she got started doing what it is that she's doing.
Thank you so much, Dr. Joy Baker. Thank you for having me here, and thanks for everyone for joining in. As you have heard, I'm a nurse by education and training and by passion. I knew when I was in college and nursing school, after seeing my first birth, feeling awed and amazed by what I just saw. I'm like, oh my gosh, I know that I want to do this for the rest of my life. And I feel very fortunate that I've been able to do exactly that. Worked as a staff nurse, worked as a charge nurse, worked as a nurse executive, always with the birthing community. And that is great. What a privilege. I feel it's such a privilege that we get to welcome new life. We get to support, to nurture, and to amplify the voice of birthing people. I think who wouldn't want to do that? I feel like it's a no-brainer, but I love it so very much, and have learned a lot, have experienced a lot, and it's really made me the person that I am today.
Wow, that is really awesome. We have a few minutes to chat today, but I really wanted you, I just have to get you to talk about this movement that you sparked called Not on My Watch. That was actually the first time I think that I heard your name and started to recognize just the brilliant work that you were doing in the maternal child health space. And I just thought it was such a brilliant hashtag, and I thought it was such a very meaningful commitment from maternal child health nurses. So, can you tell us a little bit about that before we jump into talking about
Yeah.
Antonia and Grace?
No, I'd love to. So, in 2017, I'll always remember in 2017, I was doing some research for a speaking engagement. I had taken a short hiatus from working in the hospital, from working with birthing women, and then I was back on an interim basis, and I was asked to do a speaking engagement. So, as I'm doing research to talk about um, maternal mortality, because that was the focus, I started seeing all of these headlines about women dying and how the numbers are increasing, in spite of the fact that we lived in the country that spends the most money per capita on healthcare. And it was article after article, and it was not just in like the gray journal, the green journal, ACOG's work or A1's work or ACNM's work. It was in a lay public, USA Today, the New York Times, NPR. I'm like, this is out of control. And it was out of frustration. And I'm like, what can I do? And the thought came, you know what? Not on my watch. This is not going to happen on my watch. Understanding that I don't control the whole birthing society nationwide, but I knew that I had some locus of control. And what I wanted to do was, with this hashtag, connect, right? Connect at the heart with other nurses to get them to say, no, not on my watch, because I do believe that nurses can change the trajectory of morbidity and mortality. There's 4.2 million of us. There's a lot of us. We're the biggest in the workforce. And it wasn't the initiative did not require education. We take everybody and put them in a big classroom, and you take a pretest and post test. None of that. All I wanted nurses to do what I intended with Not on My Watch is as you engage with the client, and Joy, I'll make believe that you're my patient, that I'm privileged to have you as my patient. So as I first interact with Joy, I'm like, hi, Joy, my name is Rose, and I'm going to be your nurse today. And I want you to know that I am your person, that in the 12 hours that I'm caring for you, I'm going to make sure that I listen to you. I'm going to advocate for you. I'm going to make sure I treat you with dignity and respect. I'm going to make sure that it's evidence-based care. I will not allow anything to happen that's preventable on my watch. I see you. And that was it. But how powerful is that? How
That's so
powerful,
powerful, so
right?
affirming as well. That I see you, I respect you, I will
Right.
advocate for you. That is amazing. So, how did you push that idea out to nurses? Because I was hearing it everywhere. I was hearing
Well,
about my watch.
that's super great to hear, because I remember when I first discussed it, I did a presentation at my hospital in front of about 280 leaders, and I remember saying to them, you know what? This hashtag is going to go viral. Even if that means it's viral within our healthcare system, it's going to go viral. So that was that. And then shortly thereafter, I was invited to speak at the Association of Women's Health Obstetrics and Neonatal Nursing, or A1 as we lovingly call it. I was invited to speak at the Leadership Forum in June of 2018. And so I shared that information there, a bigger platform. And it just grew. Everybody was using the hashtag, and it was just really amazing. I did a couple of articles, I did a couple of interviews. I think I was on Fox News at one time talking about Not on My Watch, but it just grew from there. And it's just from my story. And it really resonated with so many nurses. And they're the ones that amplified the work. They're like, yes, Not on My Watch. Oh, I got the t-shirt. I have the badge sticker that goes on my badge, and they wore it proudly, so that when the patient said, well, what does that mean, Not on My Watch? They can say, well, let me tell you what that means, you know? So I feel very, very privileged that I had that national presence, that I can really amplify this work.
I just was so very impressed with it. I think it was so meaningful. And so now that that's going strong, you know, the merch, everybody's got hashtag Not on My Watch. What's new with Antonia and Grace? Tell me a little bit about how you got started and what is Antonia and Grace?
Yeah, I'm happy to talk about that. It seems like what I interpret as my best ideas come out of frustration. So Not on My Watch came out of my frustration with morbidity and mortality. And I think Antonia and Grace was born out of my frustration with the disparate maternal morbidity and mortality for Black and Brown people. And I wondered, what can I do differently? What can I do? And I had this thought to create maternity concierge program. And I said, yes, that's what we can do. We can create this program, and we'll have three incredible care partners. It'll be the nurse functioning as a navigator for the client. It'll be the doula, and it'll be the lactation consultant. That the three of us, with the client in the center, we will partner with her through her pregnancy to help navigate her through the healthcare system. We know that healthcare is complicated, and it's difficult to navigate your way around. So that's that. We all know that. But we know that for women who look like us, Joy, we have even more difficulty centered around racism and centered around implicit bias and stereotypical beliefs about us. And we're not always treated with dignity and respect. We're not listened to. We are not believed. And I wanted to be part of that solution. So the thought is, with this wraparound service, that we would engage with pregnant women and birthing people, and it's a business to client relationship. So there's no insurance, there's no providers, it's just us engaging with our clients directly, and we will help them. We have this amazing education that we've created by Black people for Black birthing people, because we understand we have that shared lived experience, right? And we're going to definitely leverage that information so that we can help our clients. At the end of the day, our goal is to protect. Our goal is to help restore joy and help restore the sacredness that's associated with pregnancy. I'll tell you, Joy, I was on Instagram, I think it was probably November of last year, and I saw someone's post, and she said, I just found out I'm pregnant and I'm terrified. And
Wow.
my heart just broke. No, no, birth is not supposed to be terrifying, and she has all good reasons to be terrified. So I wanted to create something that will support and nurture and buffer, so that the focus of the birthing person is on joy and excitement and new life, and let us be a buffer around some of that, what's causing women to feel terrified.
I absolutely understand that I see a lot on social media, and I people reach out all the time in DMs and direct messages and instant messages about, I'm afraid. How do I
Right.
find someone who's going to take good care of me? How do I ask the right questions? What should I look for? Because there has been so much media attention surrounding the disparate maternal death and severe maternal morbidity, or severe injury or illness during the birthing process. And so women are aware, they know that if they are Black or brown, that they are at a higher risk for having poor maternal health outcomes. So I love the fact that you are um, planning to bring back the joy and the anticipation. So, exactly how does Antonia and Grace work? Because I think we had a conversation a few weeks ago, and I said, well, if I am blessed to be pregnant, I want to be a part of Antonia and Grace. So, how do you actually connect with the consumer?
Yeah, so we have an amazing website that we've created. So, and it's just AntoniaandGrace.com. So anyone can go to our website and contact us, and it will go directly to info at Antonia and Grace, and someone will respond immediately. So our team consists of our amazing client engagement specialists who will be the initial contact through Antonia and Grace. As we grow, we're planning to launch on May 3rd. And as we grow, we're going to partner with some physicians also to let them know that we have the service so that they can refer their patients to us, because it is a really lovely added service that we can offer to others. We're very active in social media. We're new, we're neophytes, but we're active. And this again will give us that opportunity. So let's say that you're hearing about us through Facebook Live, and you go to Antonia and Grace, will reach out to you, and we'll set up our initial conversation. So after the client engagement specialist speaks to you, then she'll connect you with a navigator. And the navigator will be the person that is your primary person throughout your pregnancy, and with several visits after birth. She'll introduce you to your doula, she'll introduce you to your lactation consultant. We will do all the background to make sure you're scheduled for your classes, to make sure that your appointments with your doula and with your lactation consultant occurs when we said it's going to occur. There'll always be a warm handoff. It's not just, here's her name, get in touch with her. No, ma'am, not at Antonia and Grace. We'll introduce you virtually via email, and then the next care partner will reach out. Hi, Joy, I'm Rose. I'm going to be your doula. I'm so excited. I can't wait to meet you. I'm going to set up a meeting with you via Zoom. We'll take care of that. Your doula will be with you during birth, and after birth, you'll have a visit from your lactation consultant. You'll have a visit from your doula, and your navigator will finally close the account with you and make sure that she's the last person that sees you and that everything is great. And then we have amazing swag that we're going to give our clients when they first join. And we have a beautiful birthday gift for once that sweet baby is born that we're going to send to you. Again, we're concierge. We want Black birthing people to feel pampered, to feel special, because we are. So we're super excited about that.
Wow, I think that is phenomenal. I would love to. I can't wait to see more and learn more about Antonia Grace. I think that this is just such a fantastic idea. I think it was something that's pretty innovative. Like Talk a little bit about your experience in the past with some birthing services. I think one thing that really interested me was that you talked about there were different tiers for Antonia and Grace,
Mhm.
because doula services and concierge services traditionally have only been available to those who were wealthy enough to afford them. And so I really love the idea that there were multiple levels that you could access with Antonia and Grace. Can you tell us a little
Yes.
bit about that?
Absolutely, absolutely. They are four levels and multiple ways. We decided to make our business a public service, public benefit company. That means we're an S corp, so we're for profit, but we're very mission driven. I tell people just to think about Ben and Jerry's, my favorite ice cream. They're a B corp because they're very mission driven and they're profit driven. I'm telling you, if I didn't already love Ben and Jerry's during last year's craziness of the pandemic and also the civic unrest, the way they came out and said we need to dismantle white supremacy. They didn't mince words, you know, they didn't talk about implicit bias, let's soften it. It's like white supremacy, let's dismantle it. But anywho, I love them because that's what we're going to be also. So we're mission and profit, right? But our mission definitely outweighs everything. And to that end, we thought, let's go ahead and develop four tiers to make it affordable and also to make it individualized, because it may be that some of our clients want a lot of touch points. You know, they want the max. I have to tell you the name of our tiers because I think
Yes.
it's so fun and so applicable for the Black birthing community. So the lowest tier is a celebrity. So who does want to be a celebrity? So we start with the celebrity, and then we have the influencer, we have the star, and we have the icon. So to
Oh, okay, icon. I love it though. It's so positive and affirming. Like who
right,
would you're treated that pampering
right,
something that we could all use when we're going through big life changes, especially
right.
in the birthing community. So I love that. Celebrity, say again, celebrity, influencer, star,
Star and
and icon,
icon.
right?
Uh-huh.
Okay.
Mm-hmm.
Fantastic. I really like
Yes.
that. So
Yeah.
with the various levels, I know because I know what's going to happen. Someone's going to send me a direct message and say, what's the investment? How expensive would it be? Because um, some of these services have been cost prohibitive for the Black community in the past, and we realize that there is that there is an emerging group of folks who, wants to have this care, but maybe have not found someone that they identify with.
Mm-hmm.
And I have been so pleased to see the surge in Black and Brown women serving as doulas. But I want to just kind of talk a little bit about the investment because it is an investment. I think it's important that we understand that we need to invest in the things that we need. We want to invest in the services that we need.
Exactly.
But I think there's a unique opportunity with Antonia and Grace to have levels of investment for what you're able to do. So I know when I want to invest in something, I save and it's important to me and I put it together so that I can get what I need. And so I kind of want to hit on that if you
Mm-hmm.
don't.
Yeah, no, I think that's a
Just,
really
just
great.
ballpark, because we don't like to get in people's financial business, but just ballpark.
I think it's that point that you just made is really important because I remember having a conversation with a couple of people, and I am blessed to have two amazing daughters. One's a nurse and one's a marketer. And as I was discussing the cost of services and trying to see, what would be something that is affordable, and she said, "You know what, mommy?" She said, your lowest rate, the celebrity." She's like, "That's what I paid for my new fireplace." She's like, "And I really wanted the fireplace and I saved money so I could have my shiplap and the fireplace and have that wall." She's like, "So it's all about people investing in what they want." I'm like, "Thank you." And I felt so much better with her saying that. So our lowest tier is 2,500. Our team talks about the designer purses. It's like, okay, this is all within the realm of affordable designer purses, not things that you've never heard of. Recently, and I don't remember the name of this designer purse that I had never heard of. And my friend said, "It's not like that cost." I'm like, "I've never heard of that. It must not be for people like me since I've never heard of it." But it is within the designer purse of the Prada, the Burberry, and the Coach purses that you're accustomed to. and it is affordable. One thing I want to say, because we were super intentional in creating Antonia and Grace as a concierge business, because what we know about Black and Brown women is that regardless of our education, regardless of our income, regardless of our zip code, so it doesn't matter where I live and how much money I make. Once I show up in an organization that may be racist, all that is seen is my Black face. So I'm treated that same regardless. It's not like I can say, no, wait, I'm important because I make this much money, because we know that everybody's important and we know that race is a social construct. So we were intentional in designing this for the middle class and the affluent Black women, because there's no services out there for the middle class and the affluent Black women. There's a lot of resources for the resource poor. It's fragmented, but especially in Atlanta, there's a lot out there that we will be sure to amplify. But we were intentional and we wanted to create this for that specific demographic, understanding again that we're B Corp, so we're going to be mission driven and we're going to make donations to services that amplify the needs of girls, adolescent, and women. So that's the way we're looking at this whole product line. So
And
that's our
I love
intentionality.
what your daughter said about that's the cost of my fireplace, because um, priority setting is very important. And what could be more important than your family, your life, and your livelihood, and your birth? I can't think of anything more important. Like, I would totally forego my baby shower to be able to, invest in doula services, because with doula and lactation and nurse navigator services, your outcomes will be better. And that's just, we just know that, because we
Absolutely.
know that folks who have access to more education, who have access to a advocate, who have access to people who can help them navigate the process, tend to do better. So, that's an investment that you're making in yourself and into your baby and into your family. So I just appreciate that there are multiple levels and that we have an option to serve women on various levels. So tell us about when Antonia and Grace, has it launched? Is it live? Like, could I go there on the website today?
So the website is live and anyone can go today. We're actually launching on May 3rd, which is just a brief couple of weeks away. So we're
I
super
know.
excited. We had our first meet and greet yesterday, a virtual meet and greet, because another thing that we're doing, I told you about the 3 important care partners, but we're also creating a wellness network, because we believe and understand that pregnancy, labor, and birth are normal physiologic events. I know that to be true. Our bodies know how to birth babies.
Yeah,
85% of the time, no intervention is needed. That baby will deliver itself, right?
exactly.
But with the medical model, we have created a lot of interventions. But anyway, that's another soapbox for another day. But what I
Right.
wanted
We'll
to
have to talk
say
about that at another live lunch for
another
sure.
time. What I want to say is that we have these amazing wellness network that we've created. So we're going to have someone who is a physical therapist, a pelvic floor physical therapist. We're going to have massage therapists as part of us. We have 3 amazing Black women who are psychologists, PhD prepared, to address mental health, because we know how underreported and undertreated that is. So that's super important to us. Health and yoga, um, integrative medicine, which is really, really important to us, especially in preconception, because there's a couple of pathways to getting pregnant. There's those of us who were fortunate enough to have spontaneous pregnancy. That's fantastic. But there are others who have to work at it, and you can go the medical model, or you can look at an integrative medicine and look at what's your hormone level, what are you eating, what can you change to prepare your body for pregnancy. So we have an amazing physician who's a functional medicine person who's joined us. So we have all of these networks. So as we speak and interface with our clients, as we're listening, it's like, and then we can say, hey, I'll give you an example. If I'm navigating someone and she's coming to me with her second pregnancy, and happened to mention that she had a third-degree laceration with her first baby, I would say, hey, have you had a chance to speak to a pelvic floor physical therapist? You know, have you
Yeah,
been
right.
intentional in strengthening your pelvic floor? So that's going to be pretty incredible as well. We want to be a one-stop shop for our clients.
Well, I can't wait. It sounds absolutely fabulous. And I encourage everyone to check out the website, take a look, see what services you might benefit from. A quick question though, if folks who don't necessarily live in the Atlanta area, will most of these services be virtual, or how can we serve those people who maybe are not in the Atlanta area?
Thank you, Joy. That's a great question that I failed to speak on. So, our celebrity tier is actually the virtual tier that anyone within the United States can use, because that is all virtual and it's all Nurse Navigator. And we've woven in an extra touch point into our celebrity tier to help our clients. I don't know, in California, in New York, in Chicago, wherever they may be, to help them to find a doula and find a lactation consultant, since we don't have a national footprint yet. So we've created that. And yes is the operative word, because we know that somebody's going to hear about this and say, dang it, but I live in New Mexico. No worries, we got you covered. So yes, we have a plan for women and birthing people who don't live in the Atlanta metro area.
Well, again, this is such a phenomenal, innovative idea, and I am so excited about it. I can't wait to blow up social media at the launch. And I thought it was so purposeful to have this conversation during Black Maternal Health Week, because we are specifically thinking about ways that we can elevate and lift the voices of Black women and to change outcomes, to drive change. And I think that nurse navigation and lactation consulting and doula services is certainly a way to move the needle in a positive direction. So I applaud you for your great ideas. You're clearly a visionary, from Not on My Watch directly to birth concierge services. I mean, this is awesome.
Thank you. Thank you so much. And thank you, Dr. Baker, for the work that you do. I was saying to Joy before we jumped on, I'm like, how are you able to do all the things that you do? Because she is very active and represents the profession OBGYN so well and represents the Black birthing community so well. So thank you for your work and your time and having really great nuggets of education that's accessible to everyone. So I appreciate you as well.
Oh, thank you. I really enjoy our conversation, and we will definitely be sure not to make this our last conversation.
Yes,
I
ma'am.
am going to share this video again, and I'll post the link to, I pin the link to Antonia and Grace's website here so
Thank
that
you.
people can ask questions, and we can post in the comments. And I will be sure to send many people your way. I think this is such a fantastic service. And I just applaud everything that you're doing to strengthen the Black birthing community and to help us achieve equity. I know that you've been on this path for a long time, and I wish you all success with Antonia and Grace.
Thank you. Thank you so much, Joy. Thanks everyone who joined in today.
We'll catch you at the next live at lunch. We'll wish you a very happy Black Maternal Health Week. And until next time, peace.